So a common area I see a restriction in when I do a TPI assessment is in thoracic rotation or shoulder turn. Okay, so a simple way to test this is you can take two golf clubs and you can see I laid them on the floor here. They're actually a 90-degree angle. I just turned them around a little bit. So how you're going to test your thoracic rotation is you're going to get a golf club, get something longer so you have some room to get it behind your back. And I'm just kind of grabbing that in the creases of my elbows here. I'm going to bring my hands on my belly. I'm going to start by straddling, like putting my knee sort of right behind the back end of that. This other leg's going to be out in front. And what I want is I want my leg straight here in front of my hip. I don't want it out to the side. So that leg's going to be up, 90-degree angle at that knee. I got my hands on my belly. From here, I'm going to rotate. Now, I don't want that knee to kick out. That knee's got to stay straight, and I'm going to rotate. And what I'm looking for is, can I get this club on this back line? Now, it doesn't show up real well on the video here, but when I look down at this golf club here is going to be parallel to this golf club here. So it's a little hard to see in the video, but you'll get the idea. So I'm going to test that right side, and then I'm simply going to switch my legs. Same thing. I'm going to get my knee out in front of my hip so it's in line, and when I turn to this left side, I don't want to see that leg move. I want to keep this leg nice and straight. And then when I make a turn, I'm going to look down and see if I can get this golf club, again, parallel to this golf club here. Okay, a little hard to see on the video, but you get the idea. So that's a big area where I see a lot of restriction in that shoulder turn. Okay, if we don't have that shoulder turn, then a lot of the low body is going to have to move to help us get that rotation. So if you find yourself struggling with thoracic mobility and you don't do real well with that test, here's the exercise I want you to do. Pretty simple. You're going to get on your hands and knees. Okay, I'll show you from the side here. And we're going to sit back towards our heels. Now, if you can't get your butt all the way back to your heels, don't worry about it. Get back as far as you can. If you have to stop here, that's fine. But we want to drop all the way back to our heels. So I got my butt on my heels. I have my hands directly underneath my shoulders. Okay. From here, I'm going to take my right hand. Right hand's going to go behind my head. I'm going to rotate my right elbow to my left forearm. Then I'm going to breathe in. And I'm going to rotate my chest open as much as I can. So when I do this motion, I'm trying to turn my chest, not just pull my arm back. So if you feel like you're just moving your arm, I want you to tuck that arm behind your back. And I'm going to have you rotate in and rotate up. As you rotate up, I want you to breathe in, pushing through this down arm to really get that chest opened up. You're going to rotate down, push through that left arm, breathe in, rotate up. And you can do about 10 or 12 reps, switch sides. Do that a few times throughout the day, and I think you'll notice a big difference in your shoulder turn. And you can also retest that motion to see how much progress you're making.